Good afternoon, everyone. I'm Tom Griffith, back on the air with breaking news. Governor Sununu and state officials are updating New Hampshire's coronavirus response. Let's listen in.
I'll be joining a lot of other governors on a call with the White House and the Vice President at 3 o'clock. So we wanted to make sure we had some good stuff to announce today, and so we wanted to make sure we were able to present, give people a little bit of an update following the weekend. Before we start, I want to take a moment and talk about something that kind of caught my attention as I was leaving the State House to come over to do the press conference. There were two newspapers sitting on the floor as I was leaving the State House. State House is kind of quiet lately, so sometimes they drop the newspapers by the press room. There's no one really there. But anyways, I was taking a look at the headlines. And, the headlines talked about a variety of things. One was the ability for us to use reusable bags in our grocery stores that we announced. There was a great story about wedding businesses doing pretty well in this state. We know all the businesses are suffering a little bit, but actually that part of the business is coming back a little bit. There was a great story in, I think it was maybe the Concord Monitor, that did a little bit of a story on Bob Baer. Very timely. Unfortunately, Mr. Baer passed away this past week. He was an incredible individual. He's responsible for bringing NASCAR and really building up what we have with our NASCAR race in Loudon, and just an amazing individual on a variety of levels. And obviously our hearts and prayers go out to the Baer family. But it got me thinking, those are our headlines today. And when you contrast that with what we're seeing nationally across the rest of the country, when you see the riots, when you see the skyrocketing COVID numbers, when you see the stories of overrun hospitals that are having trouble managing the number of COVID patients coming in, the escalating violence we see in some of our major cities across the country, it brings a little pause, I think, to all of us. It's a good time to be in New Hampshire, to be sure. We have issues. We have a COVID pandemic. We have a lot of issues we're dealing with at the state level. We don't want to minimize any of that. But let's remember what's happening in the rest of the country. And I think it got me thinking as I was coming over here that is where our thoughts and our prayers really need to be. And whether you're in Portland, Oregon, or Manchester, New Hampshire, we're all Americans, and we all want the best for our country. And we just really hope that everybody across the country they're facing some very, very tough challenges in other parts of the country. We know our numbers could spike here. We're not immune to anything, really. I think we have a great team. We can manage what comes at us. We've shown our ability to do that, our resilience, if you will, and our ability. We know that COVID numbers are going to increase here, to be sure, but we're prepared. We have capacity. We have one of the best healthcare systems in the world, and we know that as those numbers increase, we can definitely manage. But just that contrast a little bit of what's happening here in New Hampshire versus the rest of the country, it's pretty stark. It's pretty stark. And on that point, I do want to also mention we're going to have a public health update in a moment with some of the latest numbers. I want to, over the past week, as we look at the numbers coming in, and we're doing a kind of a deep dive on our numbers. Last week we had a day when we had 59 COVID cases, and then yesterday we had 7. And today we're back up in the 50s approximately. I think Commissioner Shibinette will give an update on that. So the numbers are kind of going up and down and up and down, and we're looking at exactly why that is. We're still fairly consistent with around 30, average of about 30 cases a day. Our percent positive is remaining fairly steady, of course. But I just want to remind folks not to get too excited about low numbers and too dire about higher numbers. With the overwhelming increase of testing capacity and demand in this country, we're getting a lot of these numbers coming in batched forms, and there's some other reasons too that I think we're looking into. We're doing a lot more sentinel testing in our long-term care facilities. I think we're identifying more asymptomatic individuals because we have such easy access to testing now. So I think over time we'll see whether this kind of wave, these troughs and peaks of data keep coming in, and I know Dr. Chan and the entire team at Health and Human Services will continue to look at that. But as I said, we have always known our numbers may continue to rise in the future. We expect that. We're prepared for that. But I just I saw some news articles out there about low numbers and high numbers and low numbers and high numbers. It's one of the reasons why we do average things out, why we look at that percent positive, and why we do look at things from a statewide perspective. On that note, I would just add one thing we noticed with the current COVID cases. We have approximately 600 individuals, maybe 600 or 650 individuals or so that currently have COVID that we've identified through contact tracing. in New Hampshire. I think there's only about 17 or 18 towns in the entire state of over 200 cities and towns. Only 17 or 18 have more than 5 cases currently. So it's very regionalized, which means, again, we're going to try to take a regionalized, localized approach to a lot of what we do. But there's some good news out there, to be sure. But again, we just want to make sure that people don't get, again, too excited about the low numbers, too dire about the high numbers. We've got a great team that continues to look at the data. I guess with that, that's probably a good lead into Dr. Chan and his public health update. Thank you.
Great. Good afternoon. So there are now more than 16.5 million people with COVID-19 globally, and that includes more than 4.3 million people within the United States, which includes more than 148,000 people that have died from COVID-19 in the United States. The U.S. is experiencing approximately 1 million new infections every couple of weeks. That's sort of the most current national numbers. And so we are seeing a majority of other states around the country seeing increases of COVID-19, which we're obviously watching very carefully. For New Hampshire, we will report today an additional 59 new people with COVID-19. That brings the total to 6,500 total people confirmed with COVID-19 in New Hampshire since the beginning of this outbreak in our state. There is 1 new hospitalization to report for a total of 690 people that have required hospitalization with COVID-19. And thankfully, 0 new deaths to report today. However, we're still at 409 people that have died from COVID-19, the majority of these being in our long-term care facilities, who we continue to work very closely with to try and bring outbreaks under control and prevent transmission in some of these congregate living settings. Of these 59 new infections, the majority are in the southern part of the state. More than 80% of the new individuals infected with COVID-19 that we're announcing today are from Hillsborough and Rockingham counties. That has been the case over the course of this outbreak and continues to be the case. It continues to be the situation where we're seeing the majority of infections within these counties. As mentioned in the last week, I think our numbers have increased a small amount, and we're obviously watching this very closely. But it is important to note that the percentage of all PCR-based tests that are positive still remains low, stably low in New Hampshire at around 1%, 1.5% of all PCR-based tests are positive for COVID-19. Hospitalizations remain stable and low throughout our state. Our hospitals are not nearing surge capacity. However, obviously, given what's happening around the country, with majority of other states around the country seeing increases in COVID-19, we are watching and investigating any increase in the number of infections identified in New Hampshire very closely, and we will continue to do so. Again, public health investigations, public health contact tracing is one of the tools that we have to identify infections and try and interrupt chains of transmission and prevent spread within our communities. But we continue to need everybody to do their part to protect themselves and their families, but also to protect their communities and prevent spread of COVID-19 within their communities. And so it remains very important for everybody to stay a safe distance of at least 6 feet from other people when in public places. It still remains important for people to wear cloth face coverings when out in public places, whether indoors or outdoors, where social distancing may not be able to be maintained. Hand hygiene is critically important to prevent spread of COVID-19 from surfaces to people. And we need people to stay at home if they are sick or experiencing any symptoms of COVID-19 and to go get tested. Testing remains widely available throughout the state. Testing and public health investigations are one of the tools that we have, but we need people to continue to hear and abide by these public health recommendations as well as a primary way to control transmission and prevent spread of COVID-19 within our communities. Now I'm going to hand things over to Commissioner Chibonnet. Thanks.
Good afternoon. Just 2 quick updates on long-term care facility outbreaks. Today we are closing Hillsborough County Nursing Home's outbreak, which was a significant outbreak that's been active for quite a while, so we're very happy to be closing that outbreak today. We are also announcing a new outbreak at Ridgewood Genesis in Bedford. They currently have 2 residents that are COVID positive and 7 staff members for a total of 9 people. Thank you.
Thank you, Commissioner. So a couple different announcements. I think a few very important announcements and important opportunities that we're talking about today. As what the Commissioner was just discussing, as well as Dr. Chan, we know that long-term care facilities really do face a lot of the brunt of the COVID-19 crisis, specifically here in New Hampshire. And a lot of the facilities that have had outbreaks, I think at one time we peaked at just over 20 different facilities with outbreaks. And now we're in the 4 or 5 range in terms of the number of facilities. So the frontline staff and a lot of folks have worked very, very hard to make sure we get that under control and that it's managed. And today we're announcing that the state is now undergoing a 2-week review of all long-term care facilities that have had an outbreak of COVID-19. And the purpose of the review is to analyze the ventilation systems in particular in these facilities and collect the data to find patterns between the facilities. This comprehensive review that is being taken by the Department of Health and Human Services and the State Fire Marshal's Office will analyze things like the current system within each facility, what type of air filtration might exist, how the air flows through the facility, where the facility might have sustained an outbreak, whether it's on one floor or another. And again, we know that there is emerging science to suggest that COVID-19 could be airborne. That's not confirmed, that's not verified by any means. But again, we're trying to stay ahead of these types of issues. And this review we see as a great tool to help determine how we can mitigate those potential risks going forward. The goal is to establish potential links that can be identified in the way that the ventilation system and air flows through the building so that we can be data-driven in truly everything that we do. So just a very good opportunity. We're just another example of us trying to stay ahead, and we appreciate the support of these facilities that have helped us while we go in and do these underlying investigations. Again, just all means to stay ahead of the game a little bit. Another area that we're making an announcement today surrounds education and financial support for students who have financial barriers to receiving education. Today I'm signing an emergency order that will free up additional funding for our unique annual allocation scholarship program. The unique scholarship program has existed in the state for quite some time. And we're going to temporarily expand those opportunities due to the COVID-19 pandemic. This change will increase funding for direct scholarships by up to $8 million, allowing for an additional 3,000 students to receive support with an additional 25% increase for all unique scholarship recipients. So millions of new dollars going in to help thousands of students. Again, just creating a little more opportunity for them, knowing some of the financial hardships that many of these students and institutions are facing. We know that COVID-19 has truly impacted and caused financial hardships for so many families in New Hampshire. And those families right now are trying to make those decisions in terms of what their next steps in their child's education will be. And we just want to make sure the state is doing everything that we can do to stand up and provide support and help for them. Similarly, a few weeks ago, our office received a letter from minority business owners across the state. And it was a great letter. It had ideas and potential recommended action items in our fight against COVID-19. And acknowledging that minorities and people of color have been disproportionately impacted by COVID-19, we've worked to take some additional actions. An idea that was requested in that letter included $1 million to funding for Black, Brown, and new immigrant student scholarships for schools. And while we currently already allocated millions to the USNH system and the community college system for both financial support and tuition assistance, and then you combine what we're doing today with the unique scholarship program, an additional up to $8 million for scholarships for individuals, we realize there's probably one more area we could also improve on, and that's scholarships to families in elementary, middle, and high school. Similarly, the equity report that was also released last week, and separate from the letter, there was an equity report that the state put out this last week, also highlighted education. Since education, we know, is one key factor in the social determinants of health, specifically for minority families. So merely addressing the healthcare system in isolation is not sufficient in decreasing and eliminating racial health disparities. So currently, New Hampshire scholarship organizations, they already provide families with education options to meet the unique needs of their kids in K-12 schools. We already have a great system set up for those scholarships for elementary, middle, and high school students. But the need for flexibility has obviously been very highlighted through the COVID-19 pandemic. As such, I'm putting forward $1.5 million of the Governor's Emergency Education Relief Fund towards scholarships for students and their families. These funds will provide up to 800 new scholarships for our kids all across the state. Importantly, of those that currently receive support from New Hampshire's scholarship organization, so the way that it is currently allocated, 22% are of racial and ethnic minority populations, which is more than double our statewide demographics. So we know that the dollars are going to help remedy this disparity. These hardworking families deserve our help so that their children can remain on a positive educational trajectory, and I think we can all agree this is a key step in ensuring the best health and education opportunities for all the people of New Hampshire. That same letter I received, there was a couple recommendations in it, a few, and it also had a call for funding to local organizations that support Black, Brown, and new immigrant communities. And while we have many organizations across the state that continue to do tremendous work in this area, helping those communities, we'll be committing new additional funds from the CARES Act to various organizations to help communicate and facilitate COVID-related opportunities to all of our citizens and businesses. And some examples of the work that these organizations currently perform are things like refugee resettlement programs, English as a second language services, inter-city business coalitions, and community-based COVID-19 testing services. So all important aspects of what's going on surrounding the COVID-19 pandemic. And again, just a couple of examples of this letter that I think a lot of folks had received a copy of that had come in, and we wanted to move on it as quick as we could. So again, we just want to thank them, and we'll continue to work to see not just what other suggestions within that letter, but what other suggestions and ideas could possibly come from that community where the CARES Act, under the guidelines and limitations of how those funds can be spent, might be possible in the future. Finally, one more really important thing that we want to announce, a little bit of a second and follow-up to an announcement we made a couple weeks ago surrounding our veterans. A recent study released by the Bob Woodruff Foundation raised concerns about the impact this pandemic is having on veterans, including what they called, it was a very interesting article, what they called a perfect storm of trauma, the impact of social isolation, unplanned job losses, which threatens the mental health of many of our veterans, and particularly those with pre-existing mental health conditions. Last month, we did make an announcement here for approximately $7 million for veteran services throughout New Hampshire, Veterans COVID-19 Relief and Support Fund. The fund is intended to improve outcomes for our veterans by assisting homeless veterans finding housing, helping veteran service programs provide direct services like financial assistance or mental health supports, as well as support local veteran organizations like the American Legion or the VFW, the American Legion and Veterans of Foreign Wars chapters. Today, we are opening the application process. So that's what we're really announcing for a variety of these organizations. The application will allow 3 of the $7 million to become available. Again, for organizations like the VFW, the American Legion, Disabled American Veterans chapters, there's a variety of them that can apply. Also for organizations that provide transportation or employment support, recreation and wellness services, all for our veterans. These are the type of organizations that can also apply into this fund. The application will run until Monday, August 10th, and applications on how to apply can be found at gopher, goferr.nh.gov. That's gopher.nh.gov. That's where we try to keep a link to almost all of our applications throughout the state. So again, we're just announcing that that first $3 million is available. So if you're a veteran service organization, please go online and see if you qualify, your services currently qualify in those funds. That application process will be open for another 2 weeks, and then we'll get the funds out as soon as we possibly can. So with that, we're going to open it up for a variety of questions. Hi, Paula. How are you?
You again today?
Good to see you again.
Yes. What's left in the kitty for the CARES Act? And do you think there will be reapplications of the funds that you have or new ones with the money that's still left?
Sure. So there is approximately, I'm doing this off the top of my head, I'd say approximately $200 to $250 million available in unallocated CARES Act funding, the flexible $1.25 billion that we originally received. Now, we know that a second surge is probably coming. We know there's going to be additional costs, whether it's around testing or PPE or whatever it might be this fall, and we want to be able to make sure we can provide for that. Also, to keep in mind, a lot of the funds that we allocate we're never quite sure how many people might apply in to a fund, whether it's a healthcare fund for hospitals or for dentists or for business relief or for whatever it might be. We have quite a list of funds that we've created and opportunities we've created. If for some reason all those dollars in a specific fund don't get pulled down, they can lapse back in and we can still reuse them potentially. I think we'll have a better assessment of that as we go through the fall in terms of exactly how much of each of these funds were drawn down. The broadband, we're going to announce, let's make an announcement on the broadband fund, whether this week or early next week. And I can tell you, I don't believe all 50 million. I mean, we put 50 million out there because no one really had any idea how much the applications might come in. And they came in a little bit short of that. So there's an example of some of the funds that might lapse back in. So we create the opportunities, but we're not going to waste the money if it doesn't go allocated. Also, depending on what comes out of Washington is very important. The rumor is, and it's strictly rumor that we've heard from a variety of sources, they are looking at potentially allowing states more flexibility to use their CARES Act funds, which could be both a blessing. I mean, flexibility is always a good thing, to be sure. It would have been great if they gave us all the flexibility we asked for originally. It's nice to set the rules of the game, if you will, in the very, very beginning. But even at the end, we'll take whatever flexibility they can provide. Hopefully it comes with additional support and funding for schools and things like that I think has been talked about at the nationalized level. So there will be definitely some additional funding available to cover our additional costs. And did I get the second part of your question?
We've been hearing from people that for some reason did not get Main Street funding.
Oh, sure. Yep.
I don't know whether that would go to the GAP fund or whether there would be a reissuance
Right.
of that.
So we're one of the only states in the country that is actually providing CARES Act relief for businesses and nonprofits. We've done 2 business relief funds already. The Main Street Relief Fund, about $340 million was sent out. Another 25 or 30 million just was sent out in the first round of our self-employment fund. There'll be some more dollars that are sent out this week and next week as they go through some of the details of that. Then the third piece is the GAP fund, which are businesses or organizations that just kind of fell through the cracks, didn't meet the qualifications for certain reasons. The Main Street Relief Fund was designed around more smaller businesses, self-employment. It's obvious is for the self-employed. There are folks that might not qualify for one reason. The GAP fund, $30 million sitting at the BFA to use a little more discretion. Will we have more business funds down the road? I hope so, because I think to your point, there are still businesses that maybe still don't qualify or for some reason don't get relief through the GAP fund. We want to provide them. I also think that as we go through the fall, as the dust settles a little bit economically, maybe certain businesses that thought they were going to be fine are in a tougher situation than they thought. We really didn't open up to franchises the first time, and there are a lot of very small, I guess I'd call them micro franchises in this state. I'm shocked with how little help they're getting from their parent companies, I got to tell you. The stories I've heard from the hotel industry in particular, these parent companies that have billions of dollars in lines of credit, and they're not sending it down to the franchisees. I feel terrible for some of the hotel owners and restaurant chains. And, I was talking to a guy that ran the Sunglasses Hut at the mall. It's small, but it's a brand. It's a piece of the brand. I think these larger parent organizations that literally have billions of dollars of cash at their disposal should be investing in their franchisees that support their brand and do all their frontline work. But be that as it may, it's not happening at the rate that we would like. So maybe there's an opportunity down the road to do that. It's not a guarantee. I think to the heart of your original question, we'll really have to see how big the surge comes, what dollars have to be spent on the healthcare and most critical aspects. You have to prioritize in this pandemic. And if there's an opportunity later this fall to open up another business relief fund, we'd love to do it.
Governor, I know it's a little early here, but has contact tracing revealed anything about what might be responsible for this slight uptick in numbers?
I turned to Dr. Chan on that one a little bit.
Yeah, so contact tracing is an ongoing process. So, for example, out of the 59 new people with COVID-19 that we announced today, we're still conducting the investigations. I don't have exact numbers parsing apart, risk factors, but the majority of people that we're identifying with COVID-19 continue to have some identified risk factor, whether that's direct contact or close contact with another person confirmed with COVID-19, travel, travel remains a risk factor, and then outbreak outbreak associated. So looking at the new numbers for today, we're still investigating a good proportion of those. But of the people with identified risk factors, probably about maybe a third are identified close contacts of someone else with COVID-19, another third are related with travel, another third are outbreak associated. Still the majority we're able to identify some risk factors for, but there are other individuals that we believe have picked it up somewhere in the community that we're not able to clearly identify. We believe COVID-19 continues to be present. The risk continues to be present in most communities throughout the state, and so it remains important for people to continue to follow the public health recommendations around, physical distancing and cloth face mask use, because just simply going out in public places, especially if you're getting together with groups of people, the risk is there, and so we need people to continue to take, continue to take the recommendations seriously. Thanks.
Is there a point at which, if there are cases going up for some other metric where you would start to look at closing down businesses again?
No, there's not a fixed data point. We obviously hope.
What metrics would you be looking at?
So metrics in terms of like restricting and closing down businesses. I think to Dr. Chan's point, if there's direct contact tracing that says this type of business, this type of activity, whether it's a business or an institution, facility, whatever it might be, is a key and direct cause to a lot of our increasing cases. So I think because we're so data driven and because we can process that data fairly quickly for a small state, it allows us a lot of flexibility to be very myopic about how we go about making those types of decisions. I don't think anyone wants to close businesses down, but if there's a clear pattern there, then of course we're going to address it. We still have a few other cards to play, so to say. And again, right now we're in a good spot. We know the numbers could increase. There's still other things we can do, and we'll take whatever steps are necessary to keep people safe, to be sure. But we seem to found this right balance. People are definitely wearing masks a lot more often. They're managing their social distancing. The fact that we saw our surge and it's come down and we've been able to manage it fairly well for 4+ months, for almost 5 months now, gives I think all of us, a lot of understanding that this can be managed, right? When you take that personal responsibility on yourself and you wear those masks and you maintain distancing, if we keep doing the things we've been doing, we can be very successful in the future. But if other, more drastic measures have to be taken, if we have to make pullbacks, we will, but we obviously hope we don't get to that situation. Hi.
This might be a question maybe for the commissioner, but when does that review of those long-term care facilities begin? And what are the data points that allow you guys to close an outbreak at a facility? Does that mean they're completely clear of COVID or?
Sure.
Thanks. So typically we look for about 14 days from your last time of onset of case or a positive case. So we look at the data and we look for 14 days of basically having no onset of illness to close an outbreak. And so that takes a while. Sometimes we see We'll do testing. We'll have a cluster of illness present. We'll have no new symptoms, no new illness for several days, and then all of a sudden we'll have one more pop up, right? So sometimes it tends to drag an outbreak on for several weeks to sometimes a couple of months in some of the cases of some of our long-term care facility. The review of the long-term care facility ventilation system started yesterday. So we have both the fire marshal and the licensing and certification person going out, and we're really looking at the ventilation system. First, we're starting with the facilities that had outbreaks, and is there any pattern associated with the ventilation system, air exchange, things like that, in the way the outbreak moved through the building, and then we're going to take what we learned from that evaluation and apply it to other facilities that have not had outbreaks. So we're really trying to figure out, is there anything that relates? We don't know, but this is a great starting place for us.
Commissioner, quick follow-up there.
Sure.
Why now? Why not a couple of months ago? What was the limiting factor in not being able to do an investigation like this sooner?
So I think that, our knowledge about the virus has just evolved. Really, if you remember back in March, our initial, everything we initially messaged was, people had to be ill to transmit the virus. I remember saying that back in March, and then very quickly, April, May, we started looking at asymptomatic transmission. Even in our testing protocols, we were initially due to some testing supply issues, but just what we knew about the virus, we said only people that were symptomatic would get tested, only people that were symptomatic and had underlying conditions. And we evolved that thinking, and we evolved over time. And, you know, we've said this before, is that as more information comes out, we need to be able to pivot. So in the last couple of weeks, I would say there is probably more discussion around how long droplets suspend in the air with COVID, right? So I'm sure you've seen lots of reports being written on it. Is it as simple as a droplet precaution where typically you see the droplets drop to the floor? Does it suspend for any length of time? We know that initially we talked about surface transmission. We're seeing that that's not as big of an issue now. So when we really look at how COVID is transmitted and the attack rates that we're seeing in the facilities, so the attack rates is the degree in which the residents get infected, right? And in some of the facilities, especially early on, we saw some pretty high attack rates. So we don't know what is contributing to the spread of COVID within the facilities. So we're really just looking at anything that we can look at to say, is there a way that we can enhance this ventilation system to decrease transmission? We don't know that we're going to find anything, but we're leaving no stone unturned. And this is where we're at right now with the knowledge that we've gained over the last several months. I think it's the right time to do it.
In the 20s, you said that was the amount of facilities that have seen outbreaks?
We've had 28 facilities that have closed, and we have 4 that are currently open.
Thank you.
Yep.
And funding for it, is that funding that's coming from the CARES Act or state for the testing of the ventilation?
Oh, yes. So we are, any recommendations that we make for improving, maybe changing out filters, changing something in the system will come out of CARES Act funding. Yep.
Hi.
Now that absentee ballots are available, a lot of voters who plan to use them probably are doing it for the first time.
Mm-hmm.
Are there any initiatives going on to make sure that voters feel prepared and confident in voting absentee? And outside of legislation, what is the state doing to prevent some of the hiccups that we've seen in other states? And what have we learned from those hiccups in other states?
Sure. So anyone who is, the absentee ballots are available. They're very easy to get through your town. All of the towns work with the Secretary of State and the Attorney General's office to be educated themselves in terms of what the ballots provide, how to do it, how to fill it out. Because we handle everything at a very localized level here in the state, there's a great one-on-one contact there so people can get the help they need. It isn't like we're going to have 10,000 people calling into a centralized service up in Concord that, you know, with backlogs of people. You can go right down to your town hall or pick up the phone and give them a call and ask them, you know, questions. It's a very simple process to get an absentee, very simple process to fill it out. A lot of them may be new, to be sure. In terms of what other states are doing, I don't want to go into too much of that, only because I don't completely understand how other states do their absentee process. I'll tell you, here in New Hampshire, we do it really well. We do it really, really well. We have a great, not just tradition, but a very reliable system, a system with a lot of integrity, and it has worked, you know, tried and true year after year after year. As I used to say and brag about, we've gotten our elections right 100% of the time for 100 years, and we take that very, very seriously. And so I think because the Attorney General's office works so closely with the Secretary of State, and they have such great connection with what's happening at a localized level, it's a pretty seamless system. But if people have questions, they should feel free to pick up their phone to their town. They can put them in touch with their moderator, whoever might be. Usually there's an election official in the town that kind of heads up all of those processes if they have any questions, and they should feel free to do so. But the opportunity is available now and will continue to be available almost up to the election. Yep, and one more, and then we'll take some on the phone.
I don't want to mess up Thursday too much, but we do have a NASCAR race coming up this weekend. I'm sure we're probably going to talk about that later this week. But can you just give us a sense of what, if any, message will be delivered to people who are there who are coming in? Obviously, a lot of people are coming to vacation in New Hampshire, but this is a concentrated crowd in a concentrated area. So is there going to be any kind of messaging put out to those visitors, or what kind of, I guess,
Sure.
activity will the DHHS be?
So we have a lot of statewide messaging, as we have just a lot of people coming into the state, vast majority from New England, for travel and tourism. I think the guidance, I'll take a step back and remind folks, the guidance documents that we put out were very specific. whether you're a retail facility, whether you're a travel and tourism destination, whether you're a hotel and lodging, restaurant, whatever it might be. So the number one message that we have when you come into the state, you'll see it on all of our electric boards on the sign, is first, wear a mask, maintain social distancing. It really can save lives. And we've put a lot of money behind that messaging, and we're going to continue to do so. If you're in a restaurant or a place of business, know the rules and maintain the rules, right? We have everything very public. Those businesses, for the most part, I think all understand their guidance documents and how they should be implemented. Even when you're outside, if you can maintain social distancing, please do so. Just because you're outside in the fresh air, we know that that fresh air can obviously help decrease the chance of transmission, but there have been cases where people are transmitting the virus in outdoor settings on beautiful breezy days if the crowds get too big. So when you can maintain that social distancing, please do so. And if you can't, be sure you're wearing a mask. And so that goes for the NASCAR race. It goes for Bike Week. It goes for anyone coming up on a typical weekend. That messaging really stays universal. And we'll keep pushing it out as strong as we can. We have a lot of money behind those efforts in terms of promoting those messaging, whether it's through digital media or signs on the highway and a variety of things in between. So common sense matters. Just because our numbers are low today, we've worked hard to get the numbers low. In a way, we've earned it, and so we have to keep earning it. But that comes with each of us understanding what's in those guidance documents and living and abiding by all those things that Dr. Chan goes over every week ad nauseum. I mean, just time and again, please wash your hands. Something as simple. I notice I don't think people are washing their hands as much anymore. I don't. I think we kind of were strong with it in the spring, but I feel like everyone's so focused on masks. Wash your hands a couple times a day, 20 seconds under hot water. I know it sounds silly, the governor's out there making sure people wash their hands, but please, it can be one of the most important tools you have in terms of transmitting the virus to you or loved ones in a close situation in your home. Wear your mask, social distancing, the three most important tools. If you do that, it's all very manageable.
And quickly, on a follow-up, I know a lot of our visitors for tourism tend to be regional. NASCAR can sometimes bring a crowd. I'm not sure if the Canadian folks are coming down this time around, but it's from all over the country. So if they are coming in from outside of New England, what exactly, again, do they have to do? There's self-attest?
So we don't think there's a lot of folks coming from outside New England because there's so few tickets available, right? There's only about 18,000 tickets available. Usually it's up in the 50s and 60,000. So if you're coming from New England, you're coming from the race and you go back, I mean, you can do that. That's fine. If you are going to be here, you need to attest that you have quarantined, and you can quarantine back at home. But we've made that message loud and clear all across the country to anyone that's coming in. You need to quarantine for 14 days before coming.
One more clarification on the scholarships. Is that for college students or is that any age?
So we talked about two scholarships today. The unique program is specifically for college students, and the K-12 program, that the $1.5 million that I'm putting in my education out of my education dollars, is for K-12 scholarships.
Okay. Thank you.
Okay.
So is that scholarships to private schools, parochial?
Yeah.
And so and then that governor's education fund, where is that CARES Act money or what is that?
Yeah. So there was about 8.8 or 8.9 million in discretionary dollars given to the governor. Myself, I don't know what it was in other states. It might have been different. I'm not sure how the formula was. But for in New Hampshire, about almost $9 million. We've used some of that money for this new statewide system that really links what happens with our university and community college system to all the other schools, so that better communication tools, everything from lesson plans, finding out what's due. It's a broadening of both remote learning and the hybrid models that we think may come this fall. We want to make sure everyone is on a kind of a standardized, tried and true system that's just ease of use, so you can talk to your teachers, you can find out what your assignments are, you can communicate very easily. A lot of school districts have that already, some don't. And so we've allocated a few $1 million to that statewide system as well. And I still have some in reserve. And I'll likely keep in reserve specifically for, I'll call it the students that may be falling through the cracks, especially around special education. If more services, direct services, prevention services need to be put there, or whatever else might be needed this coming fall. We're kind of trying to play it safe and appreciate that we don't know everything that might be coming, and we're going to have some resources available for that. Okay, if we could, we'll grab. Oh, sorry.
Just to clarify, was that from federal dollars? Was that CARES Act?
Oh, I'm sorry. Those are all CARES Act dollars. So that's not out of the $1.25 billion, but out of the third CARES Act package that was passed. The state received, I'm going to ballpark this, about $80 million into education, about 40 or so for K-12, another 40 or 50 for the higher education, being the university system and whatnot, and then another about $9 million into this discretionary fund that we have. Great.
from Holly with the Associated Press. Holly, please go ahead.
Hi, I have one quick question about the scholarships and then another one about contact tracing. The one about the scholarships for K through 12, am I correct that that's not specifically for minority students, but it's a program in which a significant number of participants are minorities?
That's right. It's not specifically for minorities, but those programs typically, like I said, I think the data showed about 22% of the recipients were minorities and people of color last year, and so obviously they kind of are already tapped into helping bridge that disparity within the system. So it was obviously a good process to again address some of the concerns of those individuals that provided us some information and make sure it's available for all students across the state.
Thank you. And just to follow up on Adam's question about contact tracing, aside from the outbreaks at long-term care facilities, are you seeing instances where you can say this batch of positive cases stemmed from a restaurant or a particular business or a party? In other words, like here's an example where a large number of people weren't following the social distancing guidelines.
Yeah, I'll ask Dr. Chan to answer that if that's okay.
Great, thanks for that question about contact tracing. And I think it's important to remember that there's two purposes of contact tracing. One is to try and get at the question that you asked about where did the person who was diagnosed with COVID-19 acquire it from. That's oftentimes very difficult to determine because we're asking people to think back 2-3 weeks for potential exposures. The other purpose of contact tracing, remember, is to identify people that person diagnosed with COVID-19 who they may have come into close contact with, so that those close contacts can be put under quarantined. We're now recommending close contacts be tested for COVID-19 as a way to prevent forward transmission once we've identified someone with COVID-19. I am not aware of any other than the occasional facility outbreak, like long-term care facility outbreaks. I'm not aware of any other large groups or large gatherings that have led to outbreaks. As I mentioned before, some of the investigations that we do identify whether someone might be a close contact of another person with COVID-19, right? Because we are now recommending testing for people exposed. We're going to be identifying more people who might have had close contact with somebody else and hopefully picking up asymptomatic transmission. That's the purpose of recommending testing for people that might have been exposed but are asymptomatic. We continue to identify people who are part of outbreaks, many of those long-term care facility outbreak facilities, and then travel remains the other large category. So people that might have traveled out of state, acquired COVID-19 from outside of New Hampshire, then brought it back to New Hampshire. Those are sort of the three categories where we're identifying potential risk, but we have not identified other large group gatherings that I'm aware of where that have contributed to large outbreaks like we've heard from some other states. Thanks.
Thank you.
The next question is from Rick with the Laconia Daily Sun. Rick, please go ahead.
Hi, two questions. When a coronavirus vaccine is developed, would you require school children to be vaccinated? And the second question is, all the states in the Northeast and most states in the country have mandatory mask requirements. As major events like Bike Week and NASCAR approach, as the school year approaches, as people return to work, would you consider a mandatory mask requirement?
So the first question revolves around the potential vaccine down the road, and obviously we all hope that we see one sometime in the near future. It is not anticipated that there would be any mandatory vaccine in the state. I think a lot of folks, will step up and choose to take the vaccine, but a mandatory vaccine is not anticipated at this time by any means. The second has to do with the mandatory mask order, and again, we could still go down that route if we wanted to. The number of people that have begun and really you see out there wearing masks over the past 2 weeks has skyrocketed in New Hampshire, and that's a very, I think, positive sign. I think a lot of national businesses and stores here in New Hampshire are taking that. So, virtually there's very, very few people that are out there without a mask, at least on hand. It's really up to those individuals to wear it. in those situations where they can't socially distance or where it may already be required. I look at states that have required mask orders, California or Oregon or Washington. We could keep going down the list where the numbers continue to skyrocket. Masks help. They can save lives. I firmly believe that. But a mandatory mask order isn't some end-all, be-all that just keeps everyone blanketly safe. There's very little way to enforce such an order. So at the end of the day, it's still up to each of us to take that personal responsibility seriously and wear it as often as we can, as much as we can. We know people aren't going to be 100% about it. We know that there could be situations where, you leave your house and you might not have your mask and all that. So, but I think by kind of keeping the message elevated and making sure it's truly instilled in something in our everyday culture. And it's hard to go out now and not see a vast number of people wearing masks. I think we've really been very successful in that with our messaging. And it's been a team effort. It isn't just the governor. It's a team effort across the state and in our communities and our neighborhoods. I feel like every time I put my mask on, we're sending a message to everybody that, it's important. And remember, when you wear a mask, it's not to protect you as much as it is to protect everybody around you, right? It's a sign that you're doing something for everybody else, and it has real positive effect in terms of mitigating that viral spread. So we're not at a point where I think we need to go a mandatory mask order. I think people are realizing the importance of it. It's not an end-all, be-all, and we just want to keep encouraging individuals to take that responsibility very seriously.
The next question is from Annie with New Hampshire Public Radio. Annie, please go ahead.
Hi, thanks for taking my question. Can you hear me okay?
Yes, go ahead.
Okay, good. So just first of all, any sense of what you're talking to the White House about after this? And then secondly, a follow-up for Commissioner Shibinette on the long-term care study. Are there any plans to expand that to assess staffing constraints, infection control procedures, or any other aspects of how the virus may be spreading in those facilities?
Great. I'll just answer the first one real quickly. There's a call this afternoon. I have a weekly call, at least one, if not more, with the vast majority of the other governors and the White House, usually Dr. Birx and Dr. Fauci and a variety of other folks. Secretary Azar is very often on those calls. And we always get an update in terms of PPE coming into the state, what they're seeing at a nationalized level in terms of data coming out of the CDC, a variety of different things. So we always have at least one, if not more, and that's just when they scheduled today's call. I'll turn it over to Commissioner for the second half.
Thanks. So the ventilation review that we're talking about is really not a compliance review. It is, it's really an investigatory process. We don't know, and we don't expect that any of the ventilation systems in any of the facilities are in any way non-compliant with what the standards are for long-term care. We really just want to go in and investigate to see if we can identify a pattern or if we can help. When it comes to things like infection control and staffing, a lot of that falls under compliance, and every single nursing home in the state has been surveyed by licensing and certification at least once. Several of them have been surveyed more than once. In addition to those formal processes, we have a variety of work groups that go on through the Healthcare Association, through some informal groups that communicate with the department either on a call or by email, and ask for help around staffing if they lose staffing and they need help with staffing, or if they have questions around infection control. So I think we've established the formal processes to make sure compliance is happening. I don't see that being an issue statewide. The informal processes have been up and running since the beginning of COVID. Thanks.
So just to follow up on that, when you say the nursing homes that have been surveyed for compliance, are you talking about like the CMS reviews?
Yeah.
Okay, and so we've seen so many outbreaks that are of facilities that are not reviewed by CMS, not at skilled nursing facilities, but at other retirement communities. Is there any
Assisted living.
Assisted living, thank you.
Sure.
Is there any plan to review staffing in those facilities that are not reviewed by CMS?
Assisted living facilities fall under licensing, not certification, typically by the state. If we get complaints of any kind, any word that there's a staffing issue, we can certainly send a team in there, and we have sent teams in to review any type of complaint or evidence of non-compliance with the standards. Most of our communication that we received are really around long-term care facilities, not as much assisted living. It's a lower level of care. Typically, residents are more independent in their care as compared to a nursing home where they're requiring more one-on-one care with caregivers.
The next question is from Harrison with the Rochester Voice. Harrison, please go ahead.
Yes, hello, thank you for taking my question. Governor, I know you wanted to be at the groundbreaking at Light-On last Friday, but I was wondering if you could speak a little bit about how important it is that they are breaking ground on this large facility, 2 more lines of filtration system for masks. And I wonder if you could just talk a little bit about that. I know you want to be there.
Sure. Yeah. No. A great thing happened last week. They broke ground at Light-On over in Rochester for an expansion of their facility where they make the filters in a lot of the N95 masks. And it's just awesome to be part of it. We have so many manufacturers in the state that have stepped up to be part of not just a localized, but a nationalized solution for PPE and testing materials. And Light-On is really second to none. They've done an amazing job. They continue to do so. They'll be expanding their operations. We were hoping to be at the groundbreaking. Unfortunately, given the COVID pandemic, my schedule is a little bit all over the place lately, so I couldn't be there. But it's a great organization. They keep doing great stuff, and there's going to be a need for these materials to finalize the construction of each of these N95 masks across the country for quite some time, without a doubt. So we just want to thank them for stepping up and making the investment. Great.
Just a quick follow-up, Governor, on the immunization question. So you're saying a non-mandatory for COVID-19 for schools, they do require, I think, about 5 different groups of vaccines before kids can go to school.
Sure.
So, and that's legislative control, that's the law.
Yeah, so
if it's added to the law, you would oppose, or what's the?
Yeah, no, so that's a very, very good distinction. There are a lot of immunizations that are already required to go into school. If they were to add that as part of it, yes, of course. But we're not going to, was never the intention of the governor's office to say this is mandatory for everyone, blanket everyone across the state. But of course, for schools, if the legislature were to add that and do the process, then of course we'd abide by it.
Back to the conversation about contact tracing, as test result delays continue, how useful is a test result 8-9 days after the test has been taken, and is it compromising the efficacy of contact tracing as a containment tool to have these continued delays?
Dr. Chan, good question.
Thanks for that question. That's actually that's an excellent question that we continue to struggle with, right? The question was about turnaround time for testing. And let me first reiterate, I think, what was mentioned last week, which is that the turnaround test time varies based on where somebody gets the test. So if someone's test is sent to a national laboratory, many of the national laboratories have turnaround times of more than 7 days, 7-10 days. That obviously impacts the usefulness of that test for immediate action. The turnaround time for testing within the state, if it's sent to our public health lab, is probably on the order of 1 to 2 to 3 days. We're also working with Dartmouth-Hitchcock Medical Center, who's conducting testing, overflow testing for our public health laboratories, and for other facilities, their turnaround time is on the order of a day or so. So for people that are tested in state, the turnaround time is much quicker than for specimens that are sent out of state, and that's one of the reasons why we're looking at how to increase the testing capacity within state, because the quicker that we can get test results, the more actionable that becomes. It is important to note, though, that when somebody gets tested, the recommendation is that those people that are tested should remain home and isolated. Right? They're getting tested for a reason. If they're symptomatic, if they're concerned that they have an infection, they should be staying at home pending the results of that test. When someone is identified as positive, we do our contact investigations. We identify close contacts. We then recommend that those close contacts also get tested. Sometimes the turnaround time for those test results can also be lengthy, but people that are close contacts still need to quarantine for 14 days, so it doesn't get that person, testing doesn't get that person who's exposed out of the need to quarantine. Testing is a way to identify early transmission or early infection so that we can try and trace down and stop chains of transmission. So delayed test results certainly is and will continue to likely be a challenge across the country. But remember that people that are being tested, whether because they're symptomatic or because they were exposed, still need to be staying at home for the specified duration of time, or whether they're under isolation or quarantine. Thanks.
Okay. Anything else? I think we're going to wrap it up. Well, great. Well, thanks. Oh, sorry. Yeah, sure.
The scholarships for private K-12 schools.
Yes.
Why was that idea chosen out of all the possible ways to fund education? Why that?
Well, I think we already have so the question revolves around the K-12 scholarship opportunities that are being created. We already have a great infrastructure here in the state. I think there's one or two organizations that are doing it. They're facilitating it. They're in those communities that were identified in that request in the letter. So again, it's nothing that we have to invent and hope for the best. They're already doing it, and they do a great job with it. So that's, just an obvious path and something we can just keep moving forward with and keep providing them opportunity to get more of those opportunities out to the individuals and communities that are already working with. Just easy.
And that letter that you spoke about, what group, where did that come from?
So that letter, boy, I think Deo officially signed the letter. There were a variety of different businesses that he wrote it on behalf of. We can get you a copy if need be. I think was it made public? I'm not sure. We'll make sure the press receives a copy. It was just a really good letter, just talking about a lot of the disparities, not just health disparities, but in the communities. One of the issues that came up was as we're creating these business opportunities, if English is a barrier, if language is a barrier, did those businesses know of the opportunities like everyone else did? We try to keep all of our business funds and grant opportunities very agnostic, very equitable across the mainstream. But let's recognize that there could be other barriers why people didn't communicate or didn't know about it. And there are good organizations in these communities that already facilitate some of that. So again, providing some opportunity for them to keep that communication up and facilitate those opportunities to their communities is going to be very, very important. They looked at COVID testing within those communities, making sure that we're addressing those groups. So there's not a disparity there as part of the health disparity aspect. Just a lot of different things that I think we can tackle. But we'll get you a copy of the letter. It was a great letter. Okay. Well, thank you, everybody. We want everyone to be safe. Stay cool. We're still in the middle of summer. It's warm. And as Dr. Chan said, wash your hands, wear your mask, keep social distancing. I mean, here's a challenge for you. How about everybody that's watching commits to washing their hands 4 times before they go to bed? I really mean it. Right? Let's just make that commitment. We were great about it early on. Let's just, I think if we just keep up with it and keep that mindset where it needs to be, I think even though we may see increases in numbers down the road, it's all very manageable, and we all have to take that responsibility upon ourselves. Wear your mask, stay safe. We'll be back on Thursday. Thank you.
So you've been watching Governor Sununu discuss the COVID-19 situation here in New Hampshire. There are 59 new cases today for a total of 6,500 confirmed cases. 80% of the cases announced today are from Hillsborough and Rockingham counties. No new fatalities for a total of 409 lives lost to the virus. And one more person has been hospitalized for a total of 690. One new outbreak at a long-term care facility, Ridgewood Genesis in Bedford. 2 residents and 7 staff have tested positive. The outbreak at Hillsborough County Nursing Home in Goffstown has now been closed. And the governor announcing 2 scholarship programs today, one for college students, the other for students K through 12. They will be available statewide. And the governor says our numbers will rise and the state is prepared. He said it's a good time to be in New Hampshire if you take a look at what's happening in the rest of the country. Governor stressing that you need to use common sense, wash your hands, wear a mask, and of course, social distance. Thanks for watching. We'll have much more on today's announcements, beginning with News 9 at 5.